Hi everyone, my name is Francesca Ruiz, and today I'm going to go over the topic Cognitive Disabilities Evaluation Tools. First of all, I'm going to go over what is cognition. So cognition is the mental processes including attention, memory, motivation, emotional control, motor control, sensory processing, and thinking, which is the ability to think and reason to solve problems. Second of all, what is a cognitive deficit? So a cognitive deficit is an impairment or defect in one or more of the mental functions needed for thinking. Some of these processes, which I already have mentioned above, are orientation, alertness, concentration, attention span, memory, comprehension, judgment, and problem solving. Orientation is knowledge of where one is and what time it is, like hour, day, date, and season. Also, who one is with. This is sometimes called orientation to time, place, and persons. Problems in this area are described as disorientation or confusion. Alertness is awareness of the immediate environment. Problem in alertness might be described generally as low arousal, seemingly unaware of stimulation, or clouding of consciousness, which meaning literally that the person seems to be in a fog. Or also it can be impairment of a specific aspect of alertness. Concentration and attention span are aspects of alertness. Concentration is the ability to focus one's mental energies on the task at hand, and attention span is the length of time that concentration can be maintained. Memory is the ability to recall past events and knowledge. Comprehension is the ability to understand. Comprehension is composed of many skills, including the ability to recognize words, to identify objects, to place things in order by the time or size or some other quality like information from a spoken or written passage. As to also classify or sort or groups objects in a logical fashion. Judgment is the ability to recognize and comply with established social norms and standards procedures. Like comprehension, judgment might reflect a background in social class. Problems in judgment are usually called impaired judgment. Some of the examples are urinating on the street or sitting down on a bench marked as a sign that says wet paint. Problem solving is the ability to recognize, analyze, and ultimately figure out solutions for problems that arise in the course of the everyday activities. Some examples of problems that most of the people have to solve are like budgeting money and getting from place to place. These are just some of the examples of how cognitive disability affect people, but there are many others that affect drastically the performance of ADLs and IADLs, inhibiting their participation to their fullest potential. To summarize, cognitive deficits can seriously impair a person's ability to function. A person with cognitive deficits might have a wide range of emotional reactions in response to decreasing function. When working with a cognitively impaired person, it is important to consider their emotional response and to evaluate whatever cognitive skills are still intact. There are plenty of tools OT can utilize to evaluate clients with cognitive deficits, but the one that I will go over in more detail today will be the Montreal Cognitive Assessment, also known as the MOCA, since it's one of the most used in our field and the most effective. On the next slide, I will show you some of the assessment performed by OT during the evaluation process. Okay, so as you can see in here, there are numerous of cognitive perceptual assessment available for occupational therapists to perform based on the clinical judgment and information gathered during the occupational profile. You can find these tables on the pages 908 and 909 of the Wheeler and Speckman Occupational Therapy 13th edition book. Some of these assessments are interview-based, which are perspective of client and other, such as the occupational profile, the Canadian Occupational Performance Measure, and some are awareness assessment, like the Assessment of Awareness of Disability, also known as the ADD. You can see in this chart some cognitive screening instruments as well, which are mental status exams. and comprehensive cognitive screening. There are other assessments that are performance-based testing, like assessments that measure competency or assistance required. Or let me see, some of the assignment. There's some other assignment. Okay, as you can see in here, there are other assessments like on page 909, which are cognitive tests for specific domains such as attention assessment, spatial neglect assessment, memory assessment, visual perception assessment, executive function assessment, and motor planning assessment. Okay, so as occupational therapists, it is imperative that we use our clinical judgment to choose the right assessment to be able to help our clients to reach their maximal level of independence and create goals that will be beneficial for them. So on this slide, I will go over in more detail about the Montreal Cognitive Assessment, which is also known as the MoCA, which is a short interactive test that accurately assesses multiple cognitive domains and was validated as a highly sensitive tool for early detection of mild cognitive impairment, also known as MCI, in hundreds of peer-reviewed studies since 2000. The sensitivity of the MoCA for detecting MCI is 90%. The multiple cognitive domain that is quickly and accurately assesses are short-term memory, which is remembering new information, visual spatial abilities, example like drawing, identifying spatial relationship amongst items, executive function, which are some of the samples, is like planning and problem solving, attention, concentration, and working memory, like a multiple step task, language, finding the appropriate word, and orientation to time and place, like remembering the day and knowing the current location. With proper administration and scoring, MoCA results should reflect the patient's cognitive performance accurately. As a screening tool, MoCA is not designed to diagnose a specific condition or disease. If the medical professional administering the MoCA notice a low score or observes certain issues, the patient might be referred for further consultation, including complete neuropsychological evaluation, blood tests, and imaging exam to diagnose the disease or condition. So how we can assist the patients with mild cognitive impairment, which the mild cognitive impairment is a condition in which a person's mental ability, which the memory and thinking skill, deteriorates slightly but noticeably when compared to others of the same age. The minor decline in abilities is noticeable by the person experiencing it or by others who interact with the person, but is not severe enough to interfere with daily life and activities. The MCI also is linked to Alzheimer and dementia, but it could also be related to other disease or non-disease condition. Mild cognitive impairment can be caused by a variety of factors, including Parkinson's disease, diabetes, COVID, head trauma, drug side effects, depression, and stress. As occupational therapists, we can help clients with MCI to modify their environment and give them tips to facilitate their lives so they can live their life to their fullest despite their circumstances. Some of the ones that I mentioned in here that we can help our client is to help them to install a whiteboard in the front of the home for daily or weekly to-do lists. Also, we can help them to set up the alarms, clocks, or times to ring when it's time to do a certain task, like taking their medication or the time that they have to leave the house to go for doctor appointments. We also should encourage our patient to exercise at least 30 minutes 5 times a week. Encourage them to eat a balanced diet, and to encourage them as well to dedicate substantial time for cognitive activity and to add it into their daily schedule. Thank you very much, everybody. I hope you guys enjoy my presentation and have a wonderful rest of your day. Ciao.